As it relates to chemo in particular, are there any do's and don'ts? So, questions about handling the pet, interacting with the pet, handling the pet's waste.
Yeah, this is a super important question. And there are times when I have to get into the awkwardness about asking families about their reproductive life. Uh, you know, are you pregnant? Are you trying to get pregnant? And hi, I just met you 20 minutes ago and we're going to have this discussion. But, it is something that it's super important to talk about. People who are on chemo are generally not told, don't kiss your partner, don't kiss your grandkids. We do not have any studies on does chemo come out in the saliva of pets. And so, I think the licking is something that, has to be handled on an individual basis. The important thing is that the bulk of anything coming out of the body, urine, feces, saliva, the highest levels of the chemo are going to be in the first 72 hours post chemo. However, if they're on metronomic chemo, if they're on continuous pladia, that's something else that you have to talk about. And I absolutely have had families that have chosen not to do something like metronomic chemo and have chosen something different because of people that are in their house that are immunosuppressed or their grandkids are around all the time. And, the grandkids have a swing set that's out exactly where the pet urinates and defecates. So I encourage people to, if they can, try to have their pet urinate or defecate someplace where there won't be any kids or pregnant people. If that's not possible, then, make sure that kids are wearing shoes, that type of thing. I talk a lot to families that have, like 18-month-old kids in their house because it's impossible to control an 18-month-old kid. And if a dog urinates or defecates in the house and a toddler walks through it in bare feet, they're gonna be exposed. And little kids don't have rules of hygiene, right? So generally, rules of hygiene are going to protect anyone that uses them. Wash your hands, wear gloves, those type of things. But also important to remember that the levels of chemo that we are giving are much lower than is given in human medicine. So the amount that you would be exposed to is low, but I can't tell you it's zero. I generally say it's probably similar to us taking several cross-country flights. We get closer to the sun, we have more radiation. Those are risks that we take in daily living, but they're not zero. And in the clinic, if I can add, if you have a patient that's on chemo and they're, in your clinic spending the day, or something, is don't use, for instance, for a run, a high pressure hose, because if they've urinated there, you're potentially like throwing that up into the air. It's kind of a more gentle, not the fast clean. You got to take a little bit longer to do it and to do it to protect your staff. So
It's great advice. Thank you.